Hi, my name is Schuyler Jones, and I'm a cardiologist at Duke University in the Duke Clinical Research Institute. My role in Impact MI is as a site investigator at Duke, but also as the coordinating center principal investigator, along with Adrian Hernandez. Dr. Hernandez and Dr. Javed Butler are the study chairs of our international study that's sponsored by Boehringer Ingelheim. We're studying a compound that's been investigated in patients with diabetes and heart failure called empagliflozin, and we're comparing it to placebo. And the basic idea for this study is to study patients with an acute MI who have left ventricular systolic dysfunction or acute heart failure during the acute MI. These patients are being identified in the hospital and being enrolled because we think that upfront initiation of this medication may actually prevent heart failure down the road. It's a really neat study that's being conducted at about 400 centers in 22 countries. In the United States, we have 100 sites active, and we've enrolled about 150 US patients at this point. The things that have been really fun and exciting to do is speak to each of our sites and try to understand how they approach patients, where they find them, particularly starting early, so even as early as when patients hit the emergency department, but also screening in the catheterization labs, in the ICUs, to look for common findings, such as an echo finding, or if the patients need diuretics or other medications for heart failure. We found that it's effective to screen in these multiple locations to be successful in this study. At Duke, we've enrolled 9 patients thus far. We found actually that our clinicians are engaged, so that's a really important feature. And one of our clinicians is our CCU pharmacist, Jeff Washam, who's actually identified 8 of those 9 patients. So I think as we think broadly about how we partner with our teams at our health systems or health centers, we want to partner with everybody, those people who see the patients, who make rounds daily. And then we really do think that this is an opportunity for patients to get better and to prevent heart failure. This study really is in the long line of studies like Valiant, where patients come in with acute MI and heart failure, and we think it's a really good opportunity early on in the course of disease to make patients better. We think the study will run for 1 more year and then we'll have follow-up for another year, so study results will be ready in 2023. Thanks so much for listening.